Well, heart failure is the leading cause of death in the United States, beating all cancers combined. Treating it costs more than $30 billion a year.
Yeah, and typical treatments include medications and surgery, and for the very worst cases, a heart transplant. But for those people whose medications are not helping, but they're not quite ready for a transplant, there's new hope out there. A 1 to 2 hour procedure that could help get your heart back in shape. Wink News Health medical reporter Amy Osher has a story.
Blockages, high blood pressure, heart attack, coronary artery disease. 6.5 million people are suffering from some form of heart failure.
The symptoms that patients are mostly going to have is shortness of breath.
But that can quickly turn into something more serious.
Probably 50% of patients that have heart failure are going to pass away from heart failure within 5 years.
Allegheny Health cardiologist Matthew Lander is working with teams around the world to study a first-of-its-kind, minimally invasive treatment option for heart failure. The AccuCinch ventricular restoration system aims to reduce the size of the heart's left ventricle.
It's a catheter-based device that's released into the left side of the heart.
A flexible implant is attached to the interior of the left ventricle wall and then cinched, reducing the size of the left ventricle.
The idea is that the tension and the wall stress in the heart is reduced, and that this can lead to improvement in symptoms.
Early clinical data suggests it could be a good option for people who are not responding to medications but who don't yet need a heart transplant.
There's potentially millions of patients still in that gap that need something. And this is something that can really fill that gap for some patients.
Amy Osher, Wink News.
So this procedure is in clinical trials in 80 heart centers around the world. It's a viable option when existing therapies like lifestyle changes, medications, and pacemakers are no longer able to manage those symptoms of heart failure. They hope the FDA will approve it in the next 1 to 2 years.